Greetings of the day. I am Dr. Shweta Bavari from Pharmacy Institute, Noida Institute of Engineering and Technology, Greater Noida. In this lecture, I am going to cover the pathophysiology of urinary tract infections. Urinary tract infection is the presence of microorganism in the urine or tissues of the normally sterile genitourinary tract. Now, focusing on the term itself, urinary tract infection, we are talking about the infection that basically lodges in the urinary tract or the genitourinary tract. So, bacteriuria and pyuria are the hallmarks of UTIs. When we talk about urinary tract infections, basically they can be caused by lot of type of microorganisms, pathogens. So, but the most common form of the urinary tract infections, they generally occur due to bacteria. So, we talk about the hallmarks are bacteriuria, the presence of bacteria. In other cases, when the pathogen may be fungus, in that case the presence of fungus is the hallmark. So, in the urine, bacteriuria, presence of bacteria in the urine, and pyuria, presence of white blood cells in the urine, or we also call as pus. Okay, the formation of the pus or the presence of white blood cells in the urine are the hallmarks of urinary tract infections. Urinary tract infections are among the most common infections affecting 150 million people worldwide each year, and this is generally due to poor sanitation also. If we resort to using public toilets more frequently, and this is why these are so common. Urinary tract infections are very common, and these are also due to where people are these days, due to lifestyle also, people are indulged so much in their work, they do not get time to drink sufficient water. So, in that scenario also, they do not properly take sufficient electrolytes, resort to using public uses, use public toilets, go to cinema, malls and all. So, this generally occurs due to this also. So, that is why this is very common. Urinary tract infections are very common infections. So, they affect 150 million people worldwide each year. Urinary tract infections are much more common in women than in men, because in women the periurethral area provides more places for bacteria to grow. Also, the vaginal cavity provides an additional niche for growth of bacteria. Now, we know that there is anatomical difference in the urinary tract or genitourinary tract of females and males. This anatomical difference results in it provides better opportunities for the pathogens, the bacteria, the fungus, the viruses to invade the genitourinary tract of females more as compared to men. This is due to anatomical difference in the genitourinary tract of the males as well as males and females. So, females provide a better niche depending on the area. Okay, and also the vaginal cavity in females is another niche, another place where this infection can lodge. Okay, so this is how the anatomical difference in the genitourinary tract of males and females is responsible for UTIs, which are more commonly found in females. It is more common in females as compared to males. Now, we talk about causative pathogens. See, causative pathogens can range from bacteria, fungus, they can be viruses, protozoa, trematodes. There are a variety of pathogens for urinary tract infections, but the more common ones are the bacterial infections and fungal infections that usually occur in urinary tract. So, we begin with bacterial infections of the urinary tract. Both gram-positive and gram-negative bacteria like Escherichia coli, Klebsiella pneumoniae, Staphylococcus aureus, Enterococcus fecalis, Proteus mirabilis, Pseudomonas aeruginosa, both gram-positive and gram-negative bacteria can cause urinary tract infections. Then, if we talk about fungus, the fungi like Candida species, Candida albicans, these are the most common causative features for urinary tract causative organism, microorganism for urinary tract infection. Then other less common causative pathogens for UTIs are viruses like rubella, mumps and human immunodeficiency virus HIV. The protozoa that basically causes urinary tract infection is Trichomonas vaginalis, trematode, schistosoma, hematobium, which is also known as urinary blood fluke. This causes urinary tract infection. Now we talk about the clinical characterization. When we talk about urinary tract infections, we are simply talking about the infections due to microorganisms that occur in the urinary tract or genitourinary tract. But these can be classified into as uncomplicated type and complicated type. Now the uncomplicated, as the name suggests, they are not very complex. They can occur in any healthy individual. For example, any healthy individual like a person who is healthy enough but is frequently using public toilets, for example, okay, is using public toilets, in them also this uncomplicated UTI can occur. So occurs in individuals who are otherwise healthy and have no underlying structural or functional abnormality of the genitourinary tract. They are perfectly healthy, there is no abnormality in them, the immune system is perfectly fine in those people. In them also UTIs can occur because they are resorting to use of public toilets more frequently, for example. So in them it can occur. It is uncomplicated type of urinary tract infection occurring in healthy individuals. Now we talk about complicated UTI. As the name suggests, they are more complex. The complexity resides in like they are defined as urinary tract infections associated with factors such as urinary obstruction or urinary retention caused by neurological disease, immunosuppression, renal failure, renal transplantation, pregnancy and the presence of foreign bodies such as calculi and indwelling catheters. So complicated urinary tract infections do not occur in healthy individuals. They are associated with some other type of ailment that pre-exists in an individual. For example, the person has a renal disease already. A person is already facing urinary obstruction. The urinary obstruction can be due to a kidney stone that have moved and lodged into into the ureter. A kidney stone anywhere in the urinary tract, we can also call it urolithiasis. So if there is a kidney stone or a urinary stone lodged into ureter or anywhere in the urinary tract, this can result in urinary retention. Now when urine outflow is obstructed, this will provide a very good media, it will provide a very good environment for microorganisms to grow. Urine is not moving out of the body, it is not eliminated out of the body. So it provides a growth media. So this is again a complication. Apart from these foreign bodies, urinary retention or urinary obstruction, there can be other disease conditions or ailments in an individual, or there can be the use of urinary catheters, urethral catheters or urinary catheters. When a person who had surgery or who has a renal disease and is using catheters, they also provide a very good surface for the development of for the growth of microorganisms. So this is what a complicated urinary tract infection is. It doesn't occur in healthy individuals but occurs in individuals who have certain type of ailment or some abnormality. There can be anatomical abnormality also, constriction of the ureter. The urine cannot pass out. So these type of abnormalities or ailments pre-exist, which forms a base, forms a media for the growth of the microorganisms. These UTIs are differentiated into lower UTIs and upper UTIs. Lower UTIs that occur in the lower portions of the urinary tract, they are cystitis, when the inflammation or infection of the bladder occurs, urethritis, when the infection is lodged into the urethra and it results in the inflammation of the urethra. The upper UTIs, when this infection travels to or has a result in the infection of the kidneys, which is known as pyelonephritis. So the UTIs are lower UTIs when they only infect the lower regions of the urinary tract, the urethra and the bladder. Now when the upper UTIs, when it reaches the kidney, the upper portions of the urinary tract, that is upper UTIs. The most common causative agent for both uncomplicated and complicated UTIs is uropathogenic Escherichia coli. Escherichia coli is the most common causative agent that causes urinary tract infections. Symptoms of urethritis. Now when we are talking, there are the most common sites for urinary tract infections to occur is first is urethra, then is bladder, then is kidney. So we'll discriminate the symptoms, and we can determine based upon the symptoms also that till where the infection has reached. Okay, infection moves to the kidneys generally when left untreated. Okay, so symptoms of urethritis, the infection that occurs in urethra are frequent and urgent urination. That is, there is urinary urgency. There is urgent need of urination. The person cannot hold urine inside for even a single minute. Needs to urinate immediately. That's urinary urgency, and frequency is increased. The frequency is increased, like for normal individuals who go to washroom say in 2 to 3 hours, they want to go every 15 minutes or half an hour. That's increase in that is frequent and urgent urination. Painful micturition means very much pain while voiding urine. There is lot of pain when a person voids the urine. Dysuria, again, that is pain, the burning sensation and pain while urinating. Okay, while urination there is lot of burning sensation and pain, that's dysuria. Then symptoms of cystitis. Now when the infection has traveled to the bladder, has reached the bladder. So symptoms of cystitis, which is infection of the bladder. These include frequent and urgent urination, like I told in urethritis, painful micturition, again pain while voiding the urine, while urinating, then dysuria, burning sensation or pain with urination. Apart from that, because the infection has moved to bladder, the upper region, a bit upper region, it results in suprapubic pain. Supra means above, and pubic, there is the pubic region. So in the pubic region, in the suprapubic region, the pain is felt. This suggests that the infection has moved to bladder. Hematuria, the presence of blood in urine. Malaise, uneasiness, pain in the muscles. This is what malaise is. Symptoms of pyelonephritis. Now when the infection has moved to the kidneys, we are talking about pyelonephritis. Pyelonephritis is the infection of the kidney. So the symptoms include back and or flank pain. Back pain, and when we talk about flank, it is basically this region, the waist region, the region of the waist here. Okay, so the waist region where you keep your hands. Okay, so the waist region, the pain can be felt. All right, this is basically where the kidneys are located. Okay, so then there are fever, there is fever, chills, malaise, WBC casts in urine. Now because there is infection, of course there will be infiltration of the WBCs to fight the infection. They come into the urinary tract, they come into the kidneys. Now when they remain long in the kidneys for a long duration of time, they form cast. Okay, they form cast and they are just removed in that manner only in the urine. Okay, the nausea, vomiting and anorexia, that is aversion towards food, reduced hunger, these are the symptoms of pyelonephritis when the infection reaches the kidneys. Now there are other further, if UTIs remain untreated, they can also result in very serious complications, which include frequent recurrences. Okay, there are relapses. The UTI was not treated. After the primary infection, the person felt that the symptoms are gone. If the symptoms are gone, the treatment was not given to a person. Again, there can be a possibility that the microorganisms which are indwelling, which are residing in the urinary tract have become latent for a time. Then again, this will relapse. They'll again start the infection. They can again start multiplying. So this is what the frequent recurrences means if they are not properly treated. Sepsis, host immune response resulting in severe host tissue destruction and potential loss of organ functions. Sepsis occurs basically when the infection from the kidneys also, this moves further upwards into the bloodstream. Now, you would have heard the term septic. So, when these microorganisms lodge an infection in the bloodstream itself, now this blood is going where? The blood travels through all the organs in the body. It will affect it is going to affect lot of organs in the body, and this can result in a life threatening situation. Any organ this microorganism will go along with the blood, it will result in compromising of the organ function, that is sepsis. Renal damage in young children is very frequent with the as a complication of urinary tract infection. In children, urinary tract infection can result in kidney damage in children, all right. And preterm birth, if the urinary tract infection occurs in pregnant females, it can result in preterm birth. Before the date of delivery, the birth of a child can occur. The pregnant female may deliver the child even way before, even months before the due date of delivery. Now, the pathophysiology of urinary tract infections, the route of entry of infection. When we talk about the route of entry of infection, so the route of entry of the microorganisms that cause urinary tract infection. So, there are two major routes. One is the ascending route, which begins from the urethra, the infection of the urethra, the lowermost portion, as you can see, which is attached to the bladder. So, ascending route is like, for example, when you go to use public toilets, for example. In that case, the route that will be used for causing the infection is going to be urethra. When using public toilets, the ascending route from down to upwards. There is another, the descending route. The descending route can be like, for example, if the microflora in the gut, है ना, we talk about the gut flora, there is Escherichia coli which is also residing inside our intestine, right? There are other microorganisms residing in our intestine. So, if they reach from the intestine to the urinary tract, this is descending route. The infection occurred from upwards to downwards. Also, there was an infection, say in stomach, there was an infection in the intestine, or there can be infection in any other part of the body, say in the blood, it can be in the respiratory tract. From there, that infection somehow, using the bloodstream, it entered into the urinary tract, and there it again resulted in urinary tract infection. So, the route followed was descending from up towards down. So, there are two major routes of entry of the microorganisms for causing urinary tract infection, the ascending route, the descending route. Ascending route is more important and common. Okay. Now, we talk about infection of the urinary tract that typically begins with periurethral colonization by a uropathogen residing in the gut, followed by colonization of the urethra and subsequent migration of the pathogen to the bladder. Now, what is seen that generally the infection generally starts from urethra. Now, there is one more thing, that the gut flora, the pathogens that are present, or the microorganisms that are present that are colonizing the gut already in our gut microflora, they can also migrate and then can result the ascending infection. Okay, they can also reach the urethra. They do not want any route for descending infection. They can also result in ascending infection. So, what they do, when they lodge an infection into the urethra, they colonize there. When I use the term colonize, means they start multiplying there. So, when they multiply, and subsequent migration of the pathogen to the bladder. Now, when they multiply, they have colonized, they have lodged an infection in urethra. From there, they make their way upwards to the bladder. Upon reaching the urinary bladder, the uropathogen bind to superficial epithelial facet cells, okay, the facet cells. Now, I told the infection begins from, I am describing the infection, the ascending route of infection, in which the infection is first lodged into the urethra of the urinary tract by the microorganisms that cause urinary tract infection. Once they lodge an infection in the urinary tract, they colonize there, they multiply in number there, then they make their way to the urinary bladder from there. When they reach the bladder, they do what? These pathogens, these microorganisms, they bind to the superficial epithelial faucet cells. Okay. A subset of adherent bacteria are then internalized into faucet cells. They first basically attach to the superficial epithelial cells of the bladder. They are just lying there, they are attached there, but ultimately their internalization takes place. Internalization takes place means they enter inside the cells, these faucet cells. Okay. Countering this key pathogenic activity when they have internalized into the cells, these epithelial cells or the faucet cells, host inflammatory response begin to undertake active expulsion of internalized uropathogens. Okay. Now, because of this, because they have entered into a cell, the host defense will be triggered. And what they try to do, basically, they try to expel these organisms from the cells. Okay. So, this is also, they try to expel it. Now, we are talking about bladder. When there will be expulsion of these microorganisms from the cells, they are going into urine. Now a person who is infected by these microorganisms, when urinates in a public place, in a public toilet say, this again forms the base. It is carrying microorganism that can again lodge an infection into a healthy individual, all right. So, here now focusing on countering this key pathogenic activity, host inflammatory response begin to undertake active expulsion of internalized pathogens. Still the expulsion takes place, of course host immune response is active, okay, but some uropathogens resist this immune response and undergo multiplication and biofilm formation. Now, when the human immune response, the host immune response is triggered, they immediately start doing what? Throwing out these microorganisms. They will remove these microorganisms from the cell from where they go into the urine, and urine is eliminated out of the body. That's fine. But there are certain microorganisms, not all microorganisms are removed that easily by the host defense. Okay. Some microorganisms can resist this host defense, and they do what? They start multiplying very vigorously. Large number of microorganisms are produced in response to the host response. Okay. So, and then what happens? They also produce biofilms as a protective measure. What are these biofilms? When a microorganism produces a biofilm, it encapsulates itself in a protective layer so that no host defense can act on the microorganism or kill the microorganism. That is what biofilm means. Microorganisms have that ability to produce a biofilm and protect themselves from the host immune response. Okay. These uropathogens produce toxins and proteases that induce host cell damage, releasing essential nutrients that promote bacterial survival and ascension to the kidneys. Now, because in the faucet cells, the invasion of these bacteria, viruses, these microorganisms take place, then what happens basically? These uropathogens who have resisted the host defense, okay, they are multiplying in number, they have made biofilms, and then they do what? They start releasing toxins, they start releasing proteases, the enzymes that degrade proteins. Now, the enzymes that can degrade proteins means they will result in host tissue destruction. The host tissue destructions releases exudates, or you can say when the tissue destruction in the host body, in the human body takes place, lot of cells become leaky. So, lot of materials are released. These materials act as nutrients for these bacteria and the growth medium for them. So, they multiply even more. And when they are multiplying even more, they won't curtail themselves, they won't remain in the bladder itself. From the bladder, they will make their path to the kidney, they will ascend, they will make their way to the kidneys also, and they will lodge the infection in kidneys as well. Kidney colonization further exacerbates bacterial toxin production and host tissue damage. So, what happens now when again from bladder they reach the kidney, then again they result in what? There also they multiply, they resist host response, they multiply, they form biofilms also, they multiply in large number resulting in pyelonephritis. Okay, and there also they produce what? They produce large amount of proteases, they produce large amount of toxins, so that they result in the damage to the kidney cells, to the nephrons. So the nephrons are destructed, resulting in damage there as well. Now, if this urinary tract infection that started from the urethra, lower urinary tract, which has already reached the kidneys, the upper urinary tract, upper portion of the urinary tract, if it still remains untreated or improperly treated, then it progresses to bacteremia. Bacteremia means it will enter into the blood circulation then. If the bacteremia is basically for bacteria, the other microorganisms also like fungus, the viruses, other ectoparasites also, they can pave their part to the blood circulation. Bacteremia, if the pathogen causes the tubular epithelial barrier in the kidneys, resulting in, when once in the circulation, they will result in fever, they will result in malaise and even sepsis. As I already told, what sepsis is basically? Sepsis is a septic condition where the infected blood is now going to various organ systems and infecting them as well, compromising their functions. In case of complicated UTIs, when we talk about complicated UTIs that can occur due to the obstructions in the urinary tract, they basically occur due to catheters, which is very common. When there is a urinary catheterization, catheterization itself triggers a robust immune response and cause fibrinogen deposition on the catheter, providing an ideal environment for the attachment of uropathogens that express fibrinogen binding proteins. So what happens basically when a catheter is used, urinary catheter is used, it provides a very good base. It triggers an immune response and there is fibrinogen deposition over the catheter. So when there is fibrinogen, what is fibrinogen? It is a precursor for fibrin, clot formation, right? So it is a very good base for various microorganisms that can express fibrinogen binding proteins. Various microorganisms have affinity to bind to fibrinogen and this provides them a very good growth media. And after their initial attachment to the fibrinogen coated catheters, the bacteria multiply, form biofilms, promote epithelial damage and can seed infection of the kidneys, where toxin production induces tissue damage. So if left untreated, uropathogens that cause complicated UTIs can also progress to bacteremia, or they can progress to circulation by crossing the tubular epithelial cell barrier. This is exactly same as I discussed for uncomplicated UTIs, but the only difference is that in complicated UTIs, the catheter, the blocking of the urinary tract by kidney stones, these type of the urinary retention, they themselves provide good melia, good environment for the growth of microorganisms, and the symptoms, the result are exactly same as that we discussed for the uncomplicated urinary tract infections. This image depicts the exact same steps that I just discussed and the route is ascending, the ascending type of route for urinary tract infections. Beginning from the urethra, it makes its way towards the kidneys. This is all for the urinary tract, about the pathophysiology of urinary tract infections. Thank you.